Hello everyone, welcome back to the UKMLA Roadmap series where we walk you through the MLA content map. Today we're going to talk about dermatology. First things first, make sure you look at pictures of these conditions, Google the images of all of these different conditions and familiarize yourself with what they look like, because if you get a multiple choice question, more often than not, they'll give you some background info and then they'll want you to confirm your diagnosis upon looking at the image. If you get an OSCE station, same thing, they'll probably give you an image, okay? Another thing you want to remember when it comes to dermatology is if the lesion is on the patient's face or any visible, very visible area of their body, make sure you ask about the patient's mood and how the condition is affecting, or if the condition is affecting their daily life. So make sure you do that. In the case of dermatology. Another thing about dermatology is sometimes, this is less common, but sometimes they might not give you an image, okay? Or they might give you an image that you can't diagnose the condition on. So make sure you learn the distinguishing features of these different conditions, you know, how to describe them in words. So let's say we're talking about basal cell carcinoma. Make sure you know that it's a lesion that's an ulcer with rolled margins on the face in a sun-exposed patient, okay, who has a family history maybe. So make sure you learn these conditions in that way as well. Okay, so pictures, how the lesions are described in words, and the effects they have on the patient's mood and life. Okay, now talking about acne vulgaris, very commonly tested in both multiple choice question and OSCE exams. Make sure you know the different levels of acne vulgaris, mild, moderate, and severe, and how to treat the patient in all of those different cases. So yeah, make sure you do acne vulgaris well. It may be a teenager with acne, and the teenager might be getting bullied, or they may be very self-conscious, so that's where their mood and effects on their life comes in, okay? Now, arterial ulcers, make sure you know how to examine these and how these are managed, okay? Because this hasn't shown up as much in the past, so make sure you do this well, because this is, I would say, relatively new or less commonly tested. So moving on, atopic dermatitis and eczema, very commonly tested. They love to test you in your multiple choice question exams on eczema, all the different levels of eczema, and the stepwise approach to treating eczema. In your OSCE stations, again, pictures, effect on the patient's life, and how to treat this condition, whether it's an allergy or if it's eczema. Next thing is cellulitis. This is very important. Make sure you know when to hospitalize the patient, okay, when to give the patient IV antibiotics, okay, how to diagnose the condition, okay, and how to counsel the patient. All right, so this is something that definitely has shown up in the past, and I'm sure it will show up in the future as well. Next, you have contact dermatitis. Make sure you know how to pinpoint or diagnose this condition through your history, okay, because contact dermatitis will be something you diagnose through your history in particular, okay? Next, you have cutaneous fungal infection, your tinea, your athlete's foot, that kind of stuff. Make sure you know how to treat this condition. Again, pictures, and yeah, so do this well. This does show up in exams. Tinea cruris, tinea facies, tinea capitis. You get my point. Next, you have cutaneous warts, HPV. Make sure you do that very well. It does show up. Where did the patient get HPV? Sexual history, okay, all that good stuff. And also, how to treat this, whether it's cryotherapy or through topical therapy, imiquimod, whatever, right? So another thing that does show up commonly in exams. Next, you have folliculitis. This is something that has recently started to show up in your OSCE stations. Also, they could give you an image in your MCQ stations and tell you that the patient recently went for waxing or maybe shaved or whatever, and now they have inflamed skin with comedones or little raised areas. So yeah, look at the pictures, make sure you know about folliculitis. Next, you have head lice. This is also more of a recent station in your OSCE exams. Make sure you know how to treat this, okay, and how to come to a diagnosis of head lice. This does show up in exams as well. Impetigo, honey-crusted lesions. When can my child go back to school? That's usually a common question with impetigo in children, and honey-crusted lesions is the main buzzword they use to help you diagnose the condition, and make sure you look at the image as well. Next, you have malignant melanoma. This is something that can probably show up, well, actually it could show up in both your MCQ and OSCE exams. Make sure you look at malignant melanoma pictures, because they do give you images of irregular lesions that have a lot of variation in color, and you need to diagnose malignant melanoma in that case. Maybe it's in OSCE stations and you have to break the news to the patient, or counsel them about the fact that they have cancer. So do this well. It does show up in exams. Pressure sores. This isn't something that I've seen show up as much in the past. With pressure sores, understand that it'll probably be an immobilized patient, an old patient. You have to change their position a lot, and also make sure you look at pictures of pressure sores as well. So yeah, this is something that I would say is relatively new. Next, you have psoriasis. Okay, this has shown up in the past, I'd say, in multiple choice question exams more so than your OSCE stations, but do it for your OSCE stations as well. Make sure you look at pictures again, like I said, and the treatment. Scabies, something that has commonly showed up. Usually they'll give you a history of a refugee maybe, or an underpoverished or underprivileged patient. Maybe they'll give you a child with these linear lesions on their buttock, and they'll tell you that the family is suffering from a similar itchy skin condition. So yeah, scabies can definitely show up. Squamous cell carcinoma, make sure you know how to differentiate squamous cell carcinoma from basal cell carcinoma and the risk factors. Next, you have urticaria. Okay, so the patient could be breaking out in hives. So yeah, this isn't something that I've seen, I would say, as much in OSCE exams, so make sure you do this well and you know the management. Like I said, if there is a condition that you haven't studied yet, you can just search that condition with NHS in front of it and Google it, okay? And you'll get all the info you need. So acute rash, right? Presentations, bites and stings, burns. Burns is something that shows up a lot in emergency scenarios, but also just how to treat burns. This is something that they love to test you on in multiple choice questions. May show up in OSCEs as well. So you have your chronic rash, acute rash, you've got your nail abnormalities, right? Ingrown toenail maybe, or some other kind of nail abnormality, pruritus. Maybe they'll give you a liver condition and ask you about pruritus in that case as well. Scarring, right? This may actually show up in the case of a very major trauma maybe, or maybe post-surgery, they'll ask you about scarring. Next, you have skin lesions. Of course, all of these are skin lesions. Skin or subcutaneous lump. So a lipoma may show up as well. Okay, so they might ask you about lipoma, and the patient's concerned about how it looks and they want to get it removed. Next, you have skin ulcers. Again, learn how to examine these. So that's what you need to know about dermatology. See you